Today is May 16th, 2020, and we have a New York member of the Houston Asian American Archive, Echo He, with us to speak about her COVID-19 pandemic experiences and her life stories. Thank you so much for your time to speak with us.
Of course, I'm very happy. Thanks for inviting.
Certainly. First of all, can you tell us a bit about yourself?
I'm a gallerist, curator, writer, and hat maker based in New York. I work at Pace Gallery as a research manager. At the same time, I founded and run this gallery called Folk Gallery in Brownstone in Brooklyn, Bed-Stuy area. And we call Folk Gallery an alternative space and creative lab to present artists whose works are specific to the space and who have a very who have a certain aesthetics that's more that's like connected with old soul civilizations like Asia. So we represent a lot of Chinese artists, but recently we have more international artists like our current show, Wendy Latwin. She's based in New Jersey, but her works can communicate with Asian audience very easily as she delivers certain message with like lines falling together. This philosophy is shared with the audience, with the Asian audience.
Wow, that's lovely. And your hat is lovely too. Can you tell us a little bit more about the hat?
Yeah, this hat, so I'm a hat maker and I like to make hats with stories. So each hat is different and carries its own name and meaning. This one I made during quarantine time and it's inspired by the leaves out of Folk Gallery's window. So I'll turn my camera so you can see. So there are a lot of leaves out of the window right now. But 2 months ago, when we first started stay-home order in New York, there was nothing. It was barely just empty because winter, it was still winter time. So I sit in front of the window every day and see the green leaves cover the whole window little by little. And this is a perfect demonstration of time for me, measurement of time. So I made this hat. You can see there are leaves and they look like a deer. So this is like the deer color and it's like a little anchor. So I call it a deer field. So I think this is my impression of this quarantine time.
Wow, it's like a diary for you to witness the growth and this coming of spring. That's, yeah, most profound. And can you share with us how New York is doing, how Brooklyn is doing in your perspective in this pandemic?
So New York has been shut down for 2 months, and most of us are working from home except for essential business. It's definitely an unusual experience for New Yorkers because New York is considered as a city that never sleeps. I do feel New York is becoming quieter those days and more living, like more livable and more environmental friendly. I like this change of New York. I don't feel like the city is very dead. I mean, there are a lot of things that's unusual. I remember when in March, when we first started to deliver PPEs to hospitals, when we drive along the road, it's basically empty and you would never expect New York streets can be so empty. No cars, no, a little bit cars and no passerbys and you can only hear ambulance around. And today is very sunny, so basically a lot of people are on the street with masks. So you can definitely see people tend to use bikes more and walk more and more connected to this local community.
Wow. And how about the impact to your daily life? How is working from home been?
So I it's definitely a change. No commute to the off to Manhattan every day, and like get used to meet colleagues online and with a lot of Zoom meetings for sure. For me, I think it's okay because I'm quite tech savvy. Already, so I used to work from home while I was in China. Because of visa issue, one time I got stuck in China for a whole month. So I need to work from home. And even like this international communication doesn't seem to be a big problem for me. So now I'm kind of, I think it's better to improve the efficiency, work efficiency, but I still hope one day the gallery can reopen and yeah, I can go to the physical space, and also Fall Gallery can continue to open on weekends. So people other than me can come to see the work and exchange feelings and stories during quarantine and appreciation of art.
Yeah, we're really looking forward to that day. And how do you see the technology has been changing to how we communicate with arts? Like we are seeing all these online exhibitions. Do you think that it can replace the way we communicate with art?
No, I think like anyone in the art world would think that like okay, so how can I say that? So yeah, we definitely see a lot of activities to bridge technology and art, and because galleries can open the spaces, so all the galleries are trying innovative ways to promote the artists and artworks, like online viewing rooms, IGTV, and social media campaign. All of those activities are kind of using the force of technology, but it can just never replace the experience being in the physical space, see the works, feel the aura, and communicate with the artist. Um, there are very innovative ways, like I know some galleries design an online interactive game, or like the 3D viewing room, this kind of activities. I think it's quite cool, and it's an experiment for the artists. But as a viewer, I think like we want to be able to be there and to touch the work, to feel the atmosphere, to look at the work, to reflect on the little details and ruminate. Like this kind of experience just can't be replaced by looking at things on the screen.
Yeah, I totally agree that art has a vibe around it. Um, and how do you think the Asian American artist community are reacting to the pandemic?
So I see Asian, I see a lot of Asian uh, artists very actively engaged in the pandemic. So some are creating a lot, spending studio times and making works that reflect the thinkings, the thoughts about coronavirus. And some are more involved in social activities, like donation campaign or activism of the buyers, or like, yeah, racism against the Asian community. So I started N95 for NYC in March with a group of fellow artists and professionals working in art world. A lot of us are Asian or like Chinese. 95 for NYC is a mutual aid group to source PPEs like masks and protective coveralls, this kind of medical equipment for frontline healthcare workers and the first responders in New York. So our group member are a lot of professionals in the art world or artists, and also our volunteer team, because we have a volunteer team of drivers who would go out to deliver PPEs in addition to me. So those drivers, a lot of those drivers are artists as well, and quite a large proportion of the donors and volunteers are Asian American or just Asians, because we have donors in China.
Wow, that's really encouraging, because I understand that Asian Americans are, first of all, impacted, and artists, this career and community has been very much impacted as well. That's really amazing for them to step up and help out with the others. Can you share with us some of the inspiring stories during your time to volunteer for N95 for NYC?
Okay, so let me think. Okay, so some small things I feel like really encouraged and moves me. One story is about this donor in China. She read about this campaign on Douban, a social media platform in China, which is popular about literature and art circle. I think she's high school, and she added me on WeChat and said, you know, I want to donate some money, but I'm afraid it's too little. I'm still a student. And she just transferred 200 RMB, which is about $30. And she said, I meant to come to New York for summer school in Columbia, but I guess now things are canceled. But I still want to just donate to New York, just to think, yeah, like to pay a little bit efforts, and hopefully one day I can come to New York. So a lot of those continue. So there are also people from Wuhan who was quarantined for 2 months, and finally the city opened. Or when they saw our news, they were still under quarantine. There is one lady, she's a single mother, and quarantining her apartment for over 1.5 months, and she read about this campaign and just transferred 2,000 yuan. Wow. About $300. I think that's half a month's wage for her. Mm-hmm. Yeah, and those people are just I think it's just normal people in China, and it's for such a distant cause, but they still want to help just because they're they think like they are part of it, and they just their generosity and kindness really moves me. And also a lot of healthcare workers I get in touch. They are really brave and very touching stories. So I remember there's one nurse, her name is Sachiko, and she works for 2 places. One is Isabella Center, another is North Bronx Hospital. So both places are hit very badly by coronavirus and don't have much resources because North Bronx is a small public hospital in Bronx, and Isabella Center is a nursing home. So she's Japanese, and she's single mother with 4 kids and one dog and hamster, and she has to work for 2 jobs to raise her family. But she's so positive every time I saw her. She's basically working, I think, about like every day this week. And after work, she would spend time to source PPEs for her colleagues. And the Isabella Center had over 100 deaths already. And that's only, so they have about 600 patients and over 100 deaths. And a lot of her colleagues got infected. And sometimes she would say, you know, like she would tell her kids, say that, you know, I may die very soon, very any day, but she's still very bright and optimistic to live through life. I think it's just very encouraging. And every time when I meet and get to know them, I just feel more and more deeply respect. Yeah.
Yeah, that's
yeah. So those are some stories from the front line to share.
Yeah, that's most inspiring. And how about yourself? Like, how have you protected yourself when you're delivering the mask for the hospitals?
So me and the driver both wear protective cover. So that's basically shoulder to foot. And also my hair is covered by a cap. And then the protect at my own hat. Then I would wear at least a KN95, so cover the whole, it's kind of like this type of masks, but better because this one is a fake masks we recently received, and we are trying to fight against this scam. And I also have eye goggle to cover my eye, but I don't use that too often right now because it gloves, of course. So when we go out to deliver, we don't go into the hospitals or nursing homes, and we are not allowed. So we would meet with doctors out of the building and do curbside drop off. And also a lot of times we go to their homes. Out of hospitals have restrictions of the doctors and nurses get their own PPEs. They try them to be sensitive. So a lot of doctors and nurses prefer to have their to receive those PPEs at home and secretly bring them to the hospital. And so after the whole day delivery, I would go back home, and at the door, I would first use alcohol spray to spray my whole body, the whole clothes, and then I would leave the protective cover or in the hallway. And then I would go inside room, first wash my hands, then take off the cap and different things and masks. And then so normally the mask I would reuse it because I'm not like in the hospital, that kind of exposure. I would use UV light disinfector.
Yeah.
Disinfect, so every mask can be used at least 5 times.
That's great to hear you're protecting yourself well. Can you also share some stories about your interactions with the healthcare workers? How are they doing?
So they are very stressful, but they are all very kind people and very grateful. So I know they are incredibly busy because basically I think everyone, one nurse at Amherst told me she has to work 100 hours a week. Mm-hmm. And I was in touch with another doctor at YP Brooklyn. He worked 30 hours nonstop in the past 2 days. And this basically this kind of stories, and they are very tired and lack of PPEs, but they're still like very positive. And when they receive the donation, they just so grateful and trying to like spare some time to take photos for us. So recently we start to deliver flowers. Mm. And wow, it's so you can see the difference when you deliver PPEs and when you deliver flowers. So when you deliver PPEs, the nurses are grateful. Mm-hmm. And they feel like, oh, but the eyes are they look like, okay, so we are protected and we feel grateful. But when you send flowers, they are excited and they are just super happy. And all the girls want to take one flower home. Mm-hmm. And there are almost a fight between different units to get the flowers. So one girl told me, she said, okay, last Sunday is the last day of International Nurse Week. They are very disappointed because the hospital didn't do it. Oh, wow. But they really feel grateful that local communities try to help, and they say those little things definitely very helpful, and they think they can continue to work and fight. So we sent some flowers to Sachiko to bring to Isabella Center. Today, she sent me some photo about a colleague print out a photo of a nurse who passed away because coronavirus, and place a photo aside of the flowers we donated so she can feel it. And also we deliver a large bequeath to the refrigerator truck, which carries the bodies of people who passed away. So Sachiko took a risk to bring the bequeath there. She basically go there a lot because she needs to carry the bodies to the refrigerator truck. And after she did that, she said she just feels so relieved. She thinks it's kind of like closing ceremony for her. Now her memory with the refrigerator trucks are not only death, but there's hope and flowers, kindness. So she thinks she can finally leave everything behind and think about her future life plans. Mm-hmm. And she shared, so there's a documentary filmmaker, Yun Kai, followed her and helped her to deliver those flowers. So he took a photo of her, her back with a refrigerator car. And she shared that photo within their small group in the nursing home. And one nurse commented, said, oh, that photo, I just can't help crying. And she said, I can't believe I'm so emotional, but thank you, thank you, thank you. She said a lot of thank you. Said, thank you for your friends and for you to make this happen. I think, you know, like flowers may not as essential as PPEs as a lot of people think, but they bring this strong emotional comfort, which we didn't expect either.
Wow, that's so powerful. It's sad but true. And also just thank you so much for doing all these really kind gestures and help for the healthcare community. And yeah, to the healthcare workers too.
Mm-hmm.
Yeah, I really admire your beautiful gallery and your background. How's the
So 360 viewing. See the leaves out of the two windows? It's doing very well.
Yeah, spring is definitely here, no matter where the virus is.
So yeah, it's definitely a lot of changes.
That's amazing.
But the nature and the universe has open timing.
Yeah. Definitely something that we want to revisit when it opens up again.
Mm-hmm. Yeah.
How is the gallery holding up, and are the other artists in your community holding up during this period? I guess people would have canceled shows and canceled opening receptions, and how about the income?
Yeah, that's really difficult for a lot of artists. For for our artists, I think Siyuan and Michael are impacted the strongest because Siyuan used to work for a sculpture studio, and now everything has to stop, and he doesn't have a solid income source except for that freelance job and also making work. So he's under a lot of stress, and Michael too, because Michael doesn't have a teaching job. So some other artists are a little bit better, like Ren Qianyang and Han Qing. They both teach in universities.
Mm-hmm.
So what they are also stressful because they need to think about remote teaching, especially if they are artists. Like Han Qing Ren Qianyang, she makes ceramics. So how can you teach ceramics in a remote setting? So she has to think about a lot of innovative ways. As for us, we are trying to find exhibition opportunities for those artists out of US.
Mm-hmm.
So like for Wendy, I'm trying to talk to Chengdu space about an exhibition opportunity. And for Du Mou, who is based in Beijing, I'm planning for her show in October in Beijing. So there's Tan Suyuan is going to participate in an online exhibition curated by galleries in New York. Mm-hmm. So it's just like have to think a lot of innovative ways to help those artists. And also we are, so Lin, the art director of Folk Gallery and partner of Folk Gallery, she's working with me and a lot of other galleries in New York to organize online benefit auction. So the process will help frontline healthcare workers.
That's wonderful. So what is your vision for this charity auction?
So basically now we have postponed the date to June. A little bit of very high commission, although it's a benefit auction. So we're trying to negotiate a good plan for us to make it happen. The artists are incredibly generous. Like Wang Guangle would donate a work he created in Fujian, and he would ship the work from Beijing to us and donate 100% proceeds. For this auction, we actually say we don't want artists to donate 100%. Artists should save certain proportion for them because they are going through a very difficult time. But a lot of still a lot of artists who think themselves as in less financial strike. They're like very generous to donate their works.
Yeah, that's most beneficial, and that I feel like artists having the heart to step forward and help is definitely most admired. Can you also share with us if you've seen any of the xenophobic or anti-Asian, which I heard has been going on a lot as we all see on the news?
Yeah, so on the news, so in real life, I didn't feel a lot because it just never come into my mind in New York, which is very diversified city, until in late April, I suddenly came across CDC's post on their Instagram about the cover of their new magazine. Let me see, can I find it, the article? So CDC published this journal, which is a scientific journal called Emerging Infectious Diseases Journal. And in their May issue, they are using a rank badge with leopard, wave, and some motifs from Qing Dynasty in China as the cover of that journal. So this badge has some like motifs of bats and the leopards and this like different symbols that was popular in like in ancient China as decorations. So on this post of CDC,
you can share your screen if you like.
See the origin. So CDC did some.
Oh, I was saying if you want to share your screen, you can do that too.
Or I do.
Yeah.
Okay. Let me like open my Facebook and then share the screen. Because CDC deleted the original post, so now I'm trying to. Okay. 重新了. Okay. Okay, so I'm going to share the screen. So this is CDC's cover of infectious diseases, and this is an Instagram post.
Wow.
So although this sounds neutral, so we don't, well, so first we don't, I don't want to criticize the art history interpretation here, the misleading art history interpretation here. But it's definitely, there is some connection between China and the virus. So I think any Asian, like any Chinese people who see the post would feel a little bit offended. And the first, our group member, Hansi Liao of 95YC, she found this post on Instagram and she shared with our group. And we just can't believe, we thought this is maybe CDC got hacked. And then we realized, okay, that's an official post. And also there are people comments under this post and some already been misled by CDC and think CDC is delivering this message that's connecting this virus with China. And we started to, so I shared this post on my Instagram and on my Facebook and call for friends to leave comments under this post to tell CDC that we think it's inappropriate. So a lot of my friends who are not Chinese, who are Americans or from other countries, they also feel offended by this post, think it's a weird racism message there. So suddenly this post was filled with comments like who feel inappropriate and ask CDC to take this down. So the second day, CDC took this down, which is a small victory. However, this image still stays on their journal cover. So last week, Michelle Wang published an article on hyperallergic about this cover of May 2020 issue. She is a scholar in Asian art, so she analyzed this textile from an art historical perspective and challenged CDC's interpretation of this cover image and their content. So I think this is a really good article. I don't want to say more things, but from this article, I get to know that Michelle actually contacted the editor. So she actually contacted the managing senior editor, trying to explain the problem of the Journals Association of China with COVID-19 at this very sensitive time and the fears from the Asian American community. And this editor just said, oh, very confusing. And she just saw the Chinese textile was a striking piece of art. Wow. So I think, okay, we can think that maybe they were just naive and just didn't draw the connection between the Chinese textile and this uprising racism against the Asian community. However, I think when someone already brought this to his attention, and also they have seen a lot of those comments under their public social media platform, that sounds irresponsible to me, this response. I think it's kind of like played down in this game. So I don't know what's going on. Maybe it's just a smart political game.
Wow. Yeah, it's quite disheartening to hear people using this pandemic as an excuse to become racist. And okay, great. Can you also share with us what has inspired you most during the stay-at-home order on the other end?
So I actually enjoy this shutdown moment in life. I think things get slower and I get more time to look at the leaves out of the window and see the changes of the season and appreciate different little details in life. I think our society was driven too fast by commercial consumerism and by capitalism. So this virus actually provided opportunities for human beings to reflect on our activity to the nature and to the environment and to our fellow human beings. For example, I heard a woodpecker out of the window. I think she came back every spring, but before I only get to notice her every weekend when I'm here. But now I get to spend some time with her every day and trying to track her pattern. So I noticed she's like human beings. She works from Monday to Friday, and on Saturday you don't hear her. So I wonder what's going on with her tomorrow. So this woodpecker She's like very hardworking. She get up at 6 a.m. and stop to work at around like 4 p.m. So I've become very curious. So I did a search on woodpecker and realized this species can be traced back to 35 million years ago. So her species is much, much older than humankind's. So for me, I was like looking at the numbers and start to think, oh, this species of human beings may only exist on the earth for a certain time, and who knows how longer we are going to occupy this earth. And think of that and think about the changes humankind have done to the earth. We think, you know, it may be just a second. Yeah. So definitely, I think this is a big warning from the nature to human beings to take a step back and look at the life and see what's more important. Okay, so this is one side, I think, good thing brought by the virus. Another good thing is it definitely enhances a lot of relationship. So this virus is isolating us from each other, but at the same time, we feel like connected more because we are facing the same enemy, or like spending more time communicating from heart. So I live in this building for 4 years. So Gary has been here in 4 years, and we have a lot of guests out of New York, out of the country, but we don't really spend time with our neighbors. I don't know them personally. I know their names, and they would come to the openings, but not their stories. But with quarantine for 2 months, we become very good friends. So Udon, our Gary cat, would go to catch mouse in upstairs neighbor's apartment. And our neighbor next door, she has a car, so she would volunteer to deliver PPEs sometimes. And we are also share breads and share recipes and like essentials of home because we only have one in the building, which is in my apartment. So I'm allowing the neighbor to use it as well.
Wonderful. So in a way, that's definitely brought us closer together.
Yeah, I'm just now feel comfortable, and I never close the door anymore.
So as a gallery owner and a curator, with the technology being more intertwined and inseparable in our lives, do you see artists using the digital media more predominantly in the future?
I think artists would, they have their own medium. So I do see a lot of artists are using digital media to express themselves, but there are also artists who prefer to use the traditional media, and they would use extempora, they would use gem paper, and like Wendy, she produced I would say more, but they are whether media are nowadays you or need to have certain knowledge about technology, whether Instagram or Facebook or basic computer or Photoshop. This is just basic skill for every artist. So during the coronavirus, touch with technology than ever. The artists need to use video, use IGTV or Zhibo to promote themselves. And they are thinking about different ways to create new project, which I think is very interesting.
Sorry, we got cut out a while ago when you started talking about Wendy. Do you mind talking about Wendy again? Sorry.
Okay, so so definitely I see artists are getting more and more exposed to technology. I would say artists they tend to use different mediums to create works. I won't say that new is better because a lot of artists tend to get some um, nutrition from the past. Like Michael Eade would use extempora, which is a very classic technique. And Lin Yan would use Xuan paper and ink, which can be traced back to 2000 years ago. And Wendy is using acrylic and sculpture, but she's also using some more advanced technology like laser cuts and video and projection. Those are all mediums she can use. So I think artists are using multimedia these days to create work, and even artists who are more used to traditional media, they still need to have certain skills in technology to promote themselves, especially during this quarantine time. Artists need to use video to show their studio, to communicate with the audience. To continue to show their works to the public.
Yeah, this is wonderful. Do you have anything else to add? I've run out of my questions.
I think that's basically. Reopen plans. Are we going to talk about that? So like museums and the galleries, because museums and galleries shut down in March. And so now US is facing the new stage of reopen, and museums and galleries will be the last.
Oh, wow.
So, that's New York. Sorry, so I don't know about Houston, but New York has this reopen stage plans. So Kumo said that the state is going to open gradually. So with 4 stages, the first stage would be construction, more like essential industry. So art would be the last open. For problem. Hello.
Hello?
I think.
Yeah, we lost you again. Sorry. It seems you were talking about the museums and galleries being the last to open, and then we got.
Yeah. So I think museums and galleries are designing reopen plans. So for PACE, PACE is considering requesting of the visitors to wear masks and shoe covers before entering the space. And Matt, I don't know yet about their plan, but definitely I think it would be much less visitors, and there will be requests for a book in advance or waiting outside. And for Folk Gallery, we are trying to design a special event, which is about welcoming the visitors to a new planet. So this is using a reference of Naked Sun, which is a sci-fi fiction, a sci-fi story by Asimov. And this story basically tells about a planet where everyone is isolated with each other. People live in their house and do business with a remote camera, and all the chaos were done by robots.
Oh, wow.
So it sounds very familiar, right? So face-to-face contact is considered as not clean and very contagious.
Wow.
So sounds really like our current world. So I wrote something, but it's like an opening chapter of a sci-fi story. So I'm planning to use that as an invitation when Folk Gallery reopens. So we are actually inviting our visitors to enter the space like landing in a new planet. So every hour there will be no more than 6 people in the space. So it would be by appointment. And also need to take off shoes and do disinfection with alcohol spray and wear masks. And I hope, I'm still thinking whether should encourage visitors to leave their phones behind them so they can, within this 1 hour in this isolated planet, really be immersed in art and communicate with the other fellow human beings you happen to come across on this new planet.
Yeah, art is so essential. Like we see all these artists being creative on their social media platforms, as well as being the one who is impacted most. Yeah, creativity is definitely what connects every human being. Yeah, thank you for promoting the creativity and people. And just wondering, have you experienced any anxiety or depression during your time at home alone?
So I feel actually okay. So in the very beginning, in March, I feel a little bit anxious because I thought I got coronavirus. Because Pace CEO Mark Limcher was confirmed. And I was in the same elevator. And you know, the whole building is basically, it's very easy to be close contact with coronavirus victims. And I had symptoms like headache and the breath, short breath and different things. So at that moment, I feel like I was very anxious and went to CDMD and realized that I can't get a test because I don't have a fever. So that was the first time I feel like, oh, I can't do anything in front of this virus. And also realize the crack of the medical system here, no PPEs, like even the front desk nurse at CDMD doesn't wear a mask.
Wow.
And no medicine, no medical suggestion. The person at CDMD, the doctor said, you know, I would recommend you to take some cold remedies and recover yourselves. Even if it gets really bad, if you need to call an ambulance, then go to the hospital. Don't go to hospitals. So that's an instruction here. And I got so confused in March because it's very different from China. Like it feels much safer about all the policies in China, but what else can we do? We live in this system, we just need to adapt to it. So that time I feel very anxious, but gradually I get adapted and also start to organize this PPE's donation. I think this whole experience empowered me. And now I feel, you know, like every day I get up, I have a purpose, and I get very used to this isolation time, and get to like the daily routine to be with myself and ruminate more on the universe and humankind and nature.
Yeah. And I felt like our pet through this pandemic has helped us a lot in combating isolation. And it's very nice you have Mr. Udong over there.
Yeah, but, sleeping every day. Needs to learn from him. Yeah.
Great.
Yeah. Spending more time with families and pets.
Well, thank you so much.
Yeah, thank you.